Welcome, everyone, to our live trivia show. Get ready to test your knowledge in the fascinating world of ophthalmology, the medical specialty dedicated to the eyes, vision, and everything in between. From eye anatomy to surgical procedures, we're diving deep into what keeps our vision clear and sharp. Tonight, we'll tackle 25 multiple-choice questions. Each one has 4 answer options, only one is correct. The faster you answer, the more points you earn. To play, simply comment the number of the correct option or type the full answer. Eyes are not just windows to the soul, they're windows to your score. Remember, 25 questions, 4 options, speed matters. Comment the number or full answer to play. Question 1. Which patient is expected to have the best visual acuity? 1. Reese-Buckler's dystrophy. 2. Primary familial amyloidosis. 3. Lattice dystrophy type 1. 4. Central cloudy dystrophy of Francois. Think carefully, vision clarity is key in this one. Comment the number or full answer now. Did you know? The cornea provides about 65 to 75% of the eye's focusing power. Correct answer, central cloudy dystrophy of Francois. 12 players got it right, great job. Shout out to Ahmed, Mohammed, Mawada. Question 2. All are causes of filamentary keratitis, except which one? 1. Superior limbic keratoconjunctivitis. 2. Prolonged patching. 3. Floppy eyelid syndrome. 4. Dry eyes. Think carefully, one of these doesn't belong here. Lock in your answers now. Filamentary keratitis often causes eye discomfort, foreign body sensation, and blurry vision. Correct answer, floppy eyelid syndrome. Well done. 19 out of 41 players answered correctly. Shout out to Rua, Mawada, Anas. Question 3. Which higher order aberration increases most in keratoconus eyes? 1. Vertical coma. 2. Trefoil. 3. Spherical aberration. 4. Horizontal coma. Tricky optics here. Choose wisely and trust your instincts. Submit your answers now, everyone. Keratoconus often causes distorted vision due to irregular corneal shape changes. Correct answer, vertical coma. Great job, everyone. 25 out of 41 players got it right. Shout out to Omnia, Ahmad, Justin, Iman. Question 4. Which is not an ocular finding in trachoma? 1. Transverse scarring. 2. Limbus trentus dots. 3. Herbert's pits. 4. Follicular hypertrophy. Think carefully, trachoma has some tricky signs across its stages. Lock in your answers now. Herbert's pits are healed limbal follicles seen in trachoma cases. Correct answer, limbus trentus dots. Well done. 36 of 46 players answered correctly. Shout out, Islam, Anas, Justin, Omnia, great job. Question 5. Cogan's syndrome, one statement is false. 1. Interstitial keratitis. 2. Autoimmune vasculitis. 3. Vertigo and hearing loss. 4. Optic nerve atrophy is characteristic. Tricky one. Think fast, trust your instincts, submit your answers now. Cogan's syndrome often affects young adults with sudden hearing loss. Correct answer, optic nerve atrophy is false. 38 of 46 players answered correctly, impressive. Radwa, Mohammed, Mizo, Ahmed, great work team. Question 6. Best treatment for a buttonhole in a LASIK flap? 1. Replace flap, use bandage lens. 2. Remove flap, delay PRK. 3. Remove flap, immediate PRK. 4. Apply mitomycin C. Think carefully, this one tests surgical decision-making under pressure. LASIK complications like buttonholes are rare but require precise management decisions. Correct answer, replace flap, add bandage lens. 38 of 46 players got it right. Well done Mohammed, Waima, Mariam, Ahmad. Question 7. What causes tear film instability after LASIK procedures? 1. Topical steroid treatment. 2. Decreased corneal sensation. 3. Central corneal flattening. 4. Ablation of goblet cells. Eyes feeling dry post LASIK? Let's see who knows why. LASIK can reduce corneal nerves, affecting tear film stability significantly. Correct answer, decrease in corneal nerve sensation. 40 of 45 players answered it correctly. Great job Justin, Mizo, Mohammed, Omnia. Question 8. Best IOL formula for eyes over 26 mm? 1. SRK/T. 2. SRK. 3. Holiday 1. 4. Hoffer Q. Longer eyes need precision. Let's see who's got sharp calculation skills. Axial length over 26 mm often requires special IOL formula adjustments. Correct answer, SRK/T for longer axial lengths. 37 of 47 players got it right. Well done, Justin, Mohammed, and Mohammed. Question 9. When should nucleus rotation happen during phacoemulsification surgery? 1. Position 0. 2. Position 3. 3. Position 2. 4. Position 1. Think pedal control. Timing is everything in safe, smooth cataract removal. Phaco foot pedal has 3 positions: irrigation, aspiration, and ultrasound. Timing matters. Correct answer, position 1 during nucleus rotation. Only 3 of 48 players answered correctly. Congrats Islam, Miriam, and Mohammed El Nokali. Question 10. Lowering infusion bottle helps in all except which situation? 1. Traumatic cataract. 2. Pseudo-exfoliation. 3. High myopia. 4. Dense cataract. Think fluid dynamics. Precision matters in every phacoemulsification step. Choose wisely. Lowering bottle height reduces intraocular pressure, protecting weak zonules during surgery. Correct answer, dense cataract, not ideal for lowering. 21 of 46 players got it right. Well done Mizo, Justin, Ahmad, and Mohammed. Question 11. What's the earliest field defect in open-angle glaucoma? 1. Scotoma in Jerem field. 2. Retal scotoma. 3. Nasal step. 4. Arcuate scotoma. Visual fields reveal secrets. Choose the earliest sign carefully. Glaucoma hides quietly. Peripheral vision loss is a classic early sign of glaucoma progression. Correct answer, scotoma in Jerem field. 7 of 53 players answered correctly. Great job, Miriam, Anas, and Maha. Question 12. In applanation tonometry, increased corneal thickness will lead to 1. A true low reading. 2. A true high reading. 3. A false low reading. 4. A false high reading. Think pressure, think precision, choose wisely, your answer could tip the scale. Goldman tonometry assumes average corneal thickness. Variations can skew results significantly. Correct answer, a false high reading. 40 of 53 players answered correctly. Well done Justin, Shima, Ahmed, and Ahmad. Question 13. Which condition links dental, facial issues, and glaucoma? 1. Rieger's anomaly. 2. Peters anomaly. 3. Axenfeld anomaly. 4. Aniridia. Think syndromes, think systemic. Locking your answer now, ophthalmology detectives. Rieger's anomaly affects teeth, facial structure, and eye development, often includes glaucoma. Correct answer, Rieger's anomaly. 16 of 51 players answered correctly. Iman, Sadiq, Islam, great job. Question 14. Which hypotensive drug class is unsafe for nursing mothers? 1. Non-selective beta antagonists. 2. Alpha-2 selective adrenergic agonists. 3. Cholinergic agonists. 4. Carbonic anhydrase inhibitors. Choose wisely, some meds and milk don't mix well. Beta blockers can pass into breast milk. Monitor infants for side effects. Correct answer, alpha-2 selective adrenergic agonists. 39 of 52 players answered correctly. Well done Mohammed, Asma, Ahmad, and Anas. Question 15. Which ocular toxoplasmosis treatment is false? 1. Pyrimethamine. 2. Prednisone. 3. Moxifloxacin. 4. Folinic acid. Think carefully, some drugs treat, others just don't belong here. Toxoplasmosis can reactivate in immunocompromised patients. Monitor closely for symptoms. Correct answer, moxifloxacin, not standard ocular therapy. 35 of 51 players answered correctly. Great job Asma, Mizo, Mohammed, and Ahmad. Question 16. Most common systemic link with scleritis is? 1. Systemic lupus erythematosus. 2. Rheumatoid arthritis. 3. Polyarteritis nodosa. 4. Behçet's disease. Eyes can reveal deeper issues. What's your best guess here? Scleritis often signals underlying autoimmune disease. Always investigate systemic associations carefully. Correct answer, rheumatoid arthritis, strong systemic connection. 39 of 43 players got it right. Well done, Mr. Native, Ahmed, Mizo, Ahmad. Question 17. Poor long-term outcome in frontalis suspension is reported with 1. Silicon rods. 2. Gore-Tex suture. 3. Banked fascia lata. 4. Autogenous tensor fascia lata. Choose wisely. Materials matter in surgical success and patient satisfaction. Frontalis suspension helps patients with severe ptosis regain eyelid function. Correct answer, banked fascia lata, noted complication risk. Only 10 of 42 answered correctly today. Great job, Anas, Mariam, Ahmed Hagag. Question 18. Irvine gas syndrome post-cataract. What's not appropriate treatment? 1. Topical prednisolone. 2. Topical NSAID. 3. Observation. 4. Focal/grid laser. Think carefully. Some treatments soothe, others may worsen macular edema. Irvine gas syndrome causes cystoid macular edema after cataract surgery. Correct answer, focal/grid laser, not appropriate treatment. 29 of 52 players got it right. Well done, Mr. Native, Omnia, Amira. Question 19. Reticular retinoschisis involves retinal layer splitting. Where exactly? 1. Outer plexiform and inner nuclear layer. 2. Nerve fiber and ganglion cell layer. 3. Inner plexiform and outer nuclear layer. 4. Ganglion and inner plexiform layer. Eyes on the prize. Choose your layer wisely now. Retinoschisis often appears as a smooth, dome-shaped retinal elevation on exam. Correct answer, nerve fiber and ganglion cell layer. 30 of 47 players answered it correctly. Shout out to Omnia, Ahmed, Rodi, Mizo. Question 20. Most common primary intraocular malignancy in adults is 1. Squamous cell carcinoma of conjunctiva. 2. Retinoblastoma. 3. Iris nevus. 4. Choroidal melanoma. Think carefully, malignancies in adults can be sneaky but revealing. Choroidal melanoma is the most common primary eye cancer in adults. Correct answer, choroidal melanoma. Well done, everyone. 38 of 47 players got it right. Shout out to Maizo, Nadia, Ahmed. Question 21, xanthopsia is 1. Yellow vision, 2. Red vision, 3. Green vision, 4. Blue vision. Color your guesses wisely. Vision trivia can be surprisingly eye-opening. Xanthopsia can be caused by digitalis toxicity or jaundice conditions. Correct answer, yellow vision. Great job, everyone. 43 of 52 players answered correctly. Shout out to Papo SH, Amnia, Ahmad, Mohammed. Question 22. A patient with right abducent and facial palsies, where's the lesion? 1. Pons, 2. Midbrain, 3. Medulla, 4. Cavernous sinus. Think neuroanatomy, 2 nerves, 1 clue. Lock in your answers now. The abducent nerve controls lateral eye movement, important for coordinated vision. Correct answer is pons. Well done, everyone. 29 of 45 players got it right. Shout out, Sarah, Maizo, Amnia, Ahmad, great job. Question 23. Watch closely. Fine. High-frequency eye movements are the clue. 1. Superior oblique myochemia. 2. Ocular neuromyotonia. 3. Ocular flutter. 4. Internuclear ophthalmoplegia. Trust your instincts. Lock in your answer now, eye detectives. Superior oblique muscle controls eye rotation, essential for precise visual tracking. Correct answer, superior oblique myochemia. Well done. 28 of 40 players answered correctly. Impressive. Radwa, Iman, Amira, Ahmed, great job, everyone. Question 24. Let's test your strabismus savvy. Choose the false statement. 1. Typical cycle is 48 hours. 2. Surgery is usually not curative. 3. Patching may convert it to constant esotropia. 4. Diplopia on strabismic days is unlikely. Think carefully, one doesn't belong. Lock in your answers now. Cyclic esotropia often appears in children and follows a predictable pattern. Correct answer. Surgery is usually not curative. Only 6 of 40 players got it. Well done, Dr. Hanan, Mahmoud, Islam, Mr. Native. Final question. Watch closely. What's the best next step here? 1. Systemic corticosteroids. 2. Patch the affected eye. 3. Observation and cold compresses. 4. Immediate surgical exploration. Trust your instincts. Answer now. Champions of clinical judgment. Orbital floor fractures can trap muscles, causing restricted eye movement. Correct answer. Immediate surgical orbital floor exploration. 37 of 43 players nailed it. Shout out Mohammed, Mr. Native, Ahmed, Amnia. Islam Abd Elazis takes the crown, 24 answers right. Mahmoud Mibali matches that brilliance too. Shout out to Anas, Ahmed, and more stars. Thanks to all 61 players. See you next quiz.